Joining us now from Hartford HealthCare Studios, live is Dr. Ajay Kumar, the Chief Clinical Officer of Hartford HealthCare. And Dr. Kumar, bring us up to date on how Hartford HealthCare is dealing with the statewide at this point.
Well, thank you for asking this. As you know, we've been preparing for this for several weeks, and I've talked about it before, but this is an unprecedented crisis we are seeing right now in our community. And every single day, we evaluate ourselves through our incident command process to what can we do better. So we've done a lot of different things over the several weeks. As you know, we started a screening program across all sites of the Hartford HealthCare. We created visitor access policies. We actually made them even stricter, and last week we also created a travel ban, social distancing policy. We opened a call center, 24-hour call center. We also created a virtual health and telehealth capability, and all this has been done in very short time to respond to this pandemic. Look, we've started preparing for several weeks ago, and our hope and our effort has been directed towards staying ahead of this. But right now, what we are seeing in the community spread is very concerning. And obviously, the increase in numbers we're seeing, and the exponential increase we're seeing across the United States, and even within the Connecticut, it is going to be challenging over the times as we continue to stay ahead of this.
Doctor, are you seeing elective surgeries being postponed or canceled right now?
Well, we've been evaluating it very carefully, and obviously we want to make sure that our patients and our community get the care they need. Our focus has been to make sure that the urgent and emergent surgeries are taken care of. I'm not entirely sure how sometimes to define the elective. We call it essential and non-essential, what can be postponed, what needs to be done today. As of today, Hartford HealthCare has not taken any decision either way. We're continuing our business as operation as normally. However, it might change tomorrow, it might change in several days, but we're evaluating every possible option at this time.
Gotcha. I know things are changing so fast. How is the Hartford HealthCare system doing with capacity, with beds available?
You know, we've been fortunate at this time. We started our capacity evaluation, scenario planning, and backup planning several weeks ago, so we are a little bit ahead of the curve in that sense here. We are, at least in the Hartford Hospital, we've always been very busy. Our ICU capacity is always near full, and we are at the same level at this time. I have not seen a significant stress on the system as far as the ICU capacity is concerned, but every day is a different day. Right now, we have concerns about the number of patients who could be possibly COVID positive who have been evaluated right now. Now, mind you, we've only had one patient in Hartford Hospital, and throughout the Hartford HealthCare who's tested positive, we fortunately have a lot of negatives, and we hope to see more negatives as we go forward.
Let me ask you, are any conditions changing for your clinicians as the days pass?
Yeah, it is a taxing time for our clinicians, and all colleagues across the Hartford HealthCare, 30,000 of us, are really watching this very carefully and responding appropriately. We've been fortunate, our process which we have put together of triaging and making sure the forward triaging happens, appropriate screening criteria. We've been fortunate to not expose our healthcare providers while at least in the hospital setting. And obviously there's a concern about the community setting, what spread occurs, and that's what we're keeping an eye on at this time.
And Dr. Kumar, how are you doing with basics like medical masks, the tools that you need to do your jobs?
Yeah, so we started again preparing on PPE supplies and inventory assessment and management and daily accounting on that several weeks ago. That is part of our standard work to begin with, but obviously it became heightened for us during this crisis. We continue to have a good supply at this time. However, there is a shortage of N95. We've heard from vendors and suppliers this time even more so than I heard before. So in near several days to week, depending on how the community responds, what the spread is going to be, we could face some challenges in time ahead, all of us.
All right, Dr. Ajay Kumar, thank you very much for taking the time out of your busy day to join us. We appreciate the update.